start here with panel one, which is journalists. And we are grateful to have Joshua Vaughn here today, who's investigative and enterprise reporter for PennLive. Thank you for being with us, and the floor is all yours.
Thank you very much. Chairwoman Booth, Senator Capelli, and to all the distinguished members of this committee, I'm truly humbled and honored to have the opportunity to speak with you today. As a society, we measure what we care about. When COVID hit, we scrambled our public health infrastructure in an unprecedented way to measure and track what was happening, because we understood that it was necessary to have good and reliable data about what was going on. We don't do the same with deaths in custody. Our data is spotty at best on who is dying in our jails and prisons, how they are dying, and even the most basic statistic, the number of people who die there. This year marks the 25th year since the last execution in Pennsylvania. But to be clear, people are dying nearly every single day in our jails and prisons as a result of our policies and in our names. In 2020, less than half of all deaths in jails across the Commonwealth were reported to the federal government. Our official record will reflect that 2020 was the safest time to be incarcerated in jail. However, the reality is an investigation from my outlet, PennLive, revealed that people held in our jails died at a higher rate than at any point in at least the last 20 years. In 2022, the reporting got slightly better. A little less than 2/3 of all deaths in jails, about 40 out of 65, as was noted, were properly reported to the federal government. For context, about 40% of all deaths in jails in 2022 were the result of suicide, including one man who died in Philadelphia after he was able to break the fire suppression sprinkler in his cell filled with enough water, and he drowned himself in his cell. Another third were classified as natural, although the root cause of many of those deaths can be attributed to deficient medical care. 6 individuals had their death classified as accidental. This includes drug overdoses. 2 died by homicide, and one man, Jamal Crummell, here in Dauphin County, died after developing hypothermia in his cell. His death is classified as undetermined. Despite looking into this for months, there were still 7 deaths we could not find any information on, other than noting those people that there had been deaths there. These are human lives lost in our government institutions, which have near total control over them. These are individuals whose deaths have traumatic and long-lasting ripple effects on their families, friends, and loved ones. At least 65 people died in our jails in 2022. I say at least because we don't know if there are more. 65 is the count Brittany Haler with the Pittsburgh Institute of Nonprofit Journalism and I were able to uncover after months of digging. It is not that we don't have laws on the books that are supposed to require government agencies to properly report the number of people dying behind bars. We have both state and federal laws doing just that. However, they either provide no enforcement mechanism, as is the case with the Pennsylvania law, or there just fundamentally appears to be no desire to enforce the law, as is the case with the Federal Deaths in Custody Reporting Act. Also, both federal and state laws take the reporting agencies at face value that they are reporting accurately, and both provide a massive loophole that allows counties to not report deaths simply because someone was released from custody prior to their heart actually stopping. I want to tell you a few stories of the individuals who are not in the official record. On July 23, 2021, 29-year-old Ishmael Thompson was brought into Dauphin County Prison in the midst of an apparent mental health crisis. He was taken to the hospital, checked out, returned, deeming that he was healthy to return to the jail. A few hours later, he got into an altercation with guards as he was trying to use the shower. He was pepper sprayed, had a spit hood put over his head, and he was forced into a restraint chair. He went into cardiac arrest about 10 minutes later. His brain was deprived of oxygen to the point where he went into a coma and never recovered. During the time that he was in the chair, he repeatedly told officers, "I can't breathe." He died on July 29, 2021, while in the hospital. But in the intervening time, his bail was reduced from secured bail to unsecured, and he was released from custody, and his death was not reported to the federal or state authorities. The official statement that we had for over a year on Ishmael's death was that he had a medical emergency shortly after arriving in the jail. On June 15, 2020, Joseph Klinger, a man who was being held in the Center County Jail, attempted suicide. He was taken to the hospital, and at 9 a.m. on June 16th, he was given a medical furlough and released from custody. He died a few hours later. Not only does the county not include his death and did not report his death to federal and state authorities, they contend that there has not been a death at that facility in years. Joshua Patterson died of drug overdose in 2022 in Bucks County, that he suffered in Bucks County Jail. But his death was not reported to any agency because he survived long enough to make it to the hospital and be released from custody. In Joshua's case, the drugs were brought in by another incarcerated person. The police and jail officials failed to notice that he was bringing the drugs in, despite video evidence showing that he was using the drugs in the holding cell before being sent to general population. That man has been charged with drug delivery resulting in death. Neither Joshua's death or the arrest of the incarcerated person for selling or providing the drugs were publicized. Here in Dauphin County, only 11 of 17 deaths between 2019 and 2022 were officially reported to the authorities. In 2019, Tyreek Riley died in the hospital after he went into cardiac arrest while corrections officers attempted to put him in a restraint chair. Christian Brown died in the hospital in 2019 after attempting suicide in the jail. His death resulted in the discovery of suicide prevention policy failings at the jail and the firing of at least one nurse. Terrell Thomas died at a local hospital after he began to overdose shortly after arriving at the jail. In 2022, Jimmy King was transferred to a local hospital where he died. His death is the only reported homicide in Dauphin County during that time frame. Jimmy suffered a brain bleed as a result of an altercation that he had with his cellmate. But what was missing from the record from the official story from the county was that Jimmy, on multiple occasions over the course of 2 weeks, complained about headaches, complained about blurred vision, complained about numerous symptoms of a traumatic brain injury, and that went untreated. Along with Ishmael, Carlos Lindbergh died at a local hospital in 2021 from end-stage liver failure. And I'll say it again, we count what we care about. So what does it say about us as a society that we don't take the time to count and accurately track the number of people who are dying in our correctional institutions? Thank you very much.